My name is Stubbe. I lead the German healthcare team at Edelman here in Munich. And like I said, it's a great pleasure to launch the German data for health and trust. I just need this presentation up here. There we go. Quick words on the German data. I think for this room it's quite important. The survey was conducted in February, March this year. For anybody who's a local German, that is the time when I think major discussions on German healthcare financing, insurance premiums, what does our future of healthcare look like really started. And I think so the people we asked, I think the questions we asked were very much top of mind there. A quick look back, as Alessia said, we've been doing this for a couple of years. These are the major findings for the past 4 years. So in 22, we saw that lower trust in health ecosystem is linked to less preventive care. In 23 and 24, we've seen that young people start to be overconfident when it comes to their own health. We've seen that peers and scientists are equally trusted to tell about innovation, and that culminated last year in that trust is local. My providers and peers are trusted, even my health influencers online, my medfluencers. The guy around the corner who I like personally can tell me something about vaccines. This is what we saw last year, and this year we're seeing divisive health beliefs which span the globe. So I'm going to give you 3-4 minutes of key insights, and then we're going to dive deeper into the data with the panel later on. So to start off, we are divided, not just in Germany, but globally. Globally, 2/3 of people are saying that their country is divided on healthcare issues. In Germany, that's 58%. Because of this, in Germany, 66% are saying they have lost trust in the healthcare system. So division goes on to loss of trust. So the thing is, if we see what started yesterday, we've got the World Cup. We used to be divided on who's going to win it, or our opinion of a national coach, or on politics. Now we're divided on is a vaccine safe? Is raw milk better than pasteurized milk? These are the things we're talking about. Next, we've seen a major plunge when it comes to health confidence. As you can see, in the past couple of years, we had a 61, 59, around 60% plateau when people were asked, are you confident in making informed health decisions? This has plummeted globally by 10 points, in Germany in the past year by 12 points. Which is an extraordinary finding if you think about it, that in the back of your pocket, on your mobile phone, we've got the combined health knowledge of the past 500 years, and we are pretty much unsure at this point what to do when we have a headache. What could be the reason? Well, 2 big letters which have come up every 5 minutes today may be a culprit here. So in Germany, we've got 24% of the people who we asked who are saying they use AI to manage health. Globally, we're still at the lower end of this. I think the US is far above. On a global average, we're about 35, 40% right out there. How do we use it? How do the people use it? Well, they're pretty much talking to it as it were with the doctor. And this isn't surprising, this is what we all do. Symptom check, treatment suggestions, second opinions, which are going to be a major issue, I think, in Germany in the coming years. We've got less doctors, longer waiting times for appointments, so second opinions, maybe even first opinions, are going to be an issue. And we've got personal problems and emotions. So why do people talk to AI? Maybe because you don't have to wait 3 months for an appointment. You don't have to wait 90 minutes in the waiting room reading an old magazine, and then you have more than 3 minutes face-to-face time with your doctor. So that's all possible push factors towards AI. Every year there's a kind of shocking slide and the dystopian one, and not the really feel-good part of this presentation. It's this one this year. So among the people fluent with AI, these people are saying they can do at least one of these fancy tasks better or just as well as a doctor. Answer general medical and health questions, triage care, determining proper treatment of medication, diagnosing an illness or a condition, or 10%, so look around the room, 10% are very, very sure that they can perform basic medical procedures better than a doctor. This is okay if I've got a plumbing issue at home, or if I want to do a garden terrace and I watch a couple of YouTube videos. I think the consequences there are variable but controllable. Performing basic medical procedures based on what ChatGPT tells me is a bit of an issue, to say the least. Why do people go to AI? I mean, we're seeing that the trend is going there. It's not going to stop. Basically, they're saying it's non-judgmental. it's easy to understand, and it's sensitive to my personal constraint. Bottom line, empathy, clarity. Which means for all the people who are busy communicating here, I think there's two truths. People are not looking for more information. They've got enough. AI has just added another layer. So they're looking for navigation. They're completely confused, as you saw with the 10% plunge on health confidence. So less content, more navigation. And number two, and I think this is where one of the major things I want to talk with my panel, what is trust? Because trust used to be based on authority. A couple of hundred years ago, we added expertise. Then you trust people who know stuff. And nowadays, I think we're at an age where trust means understanding. I understand you, therefore I trust you. Which means in a healthcare context, all of us here in this room know what is right, what is wrong, what are facts, what are not, what is fake news. But that is not enough anymore in a healthcare sphere. It's not enough to be right. You have to be trusted. And I think as every parent, doctor, patient, politician knows, those two things, being trusted and being right, those are not the same. And with that, I would like to introduce to the stage my wonderful panel of Ariane Malfertheiner of MSD, head of comms there, Courtney Gray Haupt, global chair at Edelman in the US, and Philipp Steitz of Merck in Darmstadt. So to start off, Ariane, what do you think explains the growing loss of confidence in healthcare and healthcare information in Germany? Big question. I mean, no pressure.
Thank you. So I don't think that erosion in confidence or in trust arrives from one single issue, but it's rather a combination of signals that people are picking up. On the one hand, if we look at the public debate on healthcare, it's very much focused on cost pressure. We all know that Germany is now undergoing one of its most fundamental reforms in healthcare, and while we are here, the Bundestag is debating on the next steps, and that creates a paradox where trust erodes from all sides, because patients hear that the system is under threat. Healthcare providers feel squeezed. The pharmaceutical company is often positioned mainly as a cost driver rather than part of the solution. And I think what makes this paradox even more striking is that the political debate focuses on cutting costs, and we are overlooking where savings are. You talked about prevention also earlier, so it's prevention. Today is the cholesterol day, and we just recently published a report with the Office of Health Economics in London that shows that elevated LDL cholesterol alone cost German economy 17.3 billion a year. So, and if we take all cardiovascular diseases, it amounts to 50 billion euro a year. And these are very preventable conditions, but people need to know about their risk, and the system needs to prioritize early detection, which is not the case right now. And this disconnect creates the feeling that the system isn't working for me. And there comes then uncertainty, and there comes mistrust. And this is what we also heard from your keynote earlier, that there is this disconnection, that people don't feel that they can get all the information, and that is where mistrust in the overall system is coming from.
Got it. And Courtney, I'm going to take up the cholesterol point here, and I'm going to ask you for a view from across the pond, where I'm seeing Kid Rock and Mike Tyson giving nutritional advice. So are we talking about, are we talking about a German issue here, or is this something in the US or something on a global level?
I mean, I think the data really shows that what we're seeing is certainly not isolated to Germany. It is a global issue. It's very much an issue in the United States. Surprisingly, our hypothesis going into the research this year was that maybe the United States, just because of the political divisions, would have the most pronounced sense of divisive health issues, the largest plummeting in trust, some of the biggest issues. We found, in fact, it was quite middle of the road. I found it really interesting that Germany had the highest level of concerns about the political divisions that are really a result of where we're seeing things today. So totally a global issue. The data also speaks to some really interesting trends. You know, Carl, you talked about sort of that journey over the past couple years with our research. 3 years ago, what the research found was that people really felt like they were in a polarized world when it came to trust in healthcare. They were having declining trust in the government. I don't trust the media to report accurately and honestly on health issues, except for my media that I look at. They moved into camps. Then last year, we found this evolution into a state of grievance. People started saying, I think if you're not with me, you're against me. If the government isn't recommending something that I believe in, it's against me. If a business doesn't support what I feel I need or isn't treating me fairly, they're against me, which was a very different move we saw. And then this year, this idea of fragmentation, that people are looking in so many different places for information and insight, whether it's AI, whether it's going to your doctor, which I will say the good news here is that the doctor is still the most trusted voice when it comes to health information. But to your point, we have a doctor shortage coming. Some people don't have access to a doctor, so we need to really think about that. And then more and more, they want to talk to a peer, a friend, a family member. They want to talk to a creator online. They want to talk to other voices. So the Kid Rock and Mike Tyson example, there definitely are people that will hear what they say on a health issue and think, you know what, that might make sense.
I'm going to go pick up the my doctor part, because we saw that in Germany as well, especially. And it's always this, if you ask German, who do you trust? It's mein Hausarzt. Do you trust doctors in general? Hausärzte? No, I don't trust Hausärzte. I trust mein Hausarzt. I trust the person who's close to me, who I see every month or something. So, Philipp, so despite the declining trust, doctors are still on number one. So what does this tell us about how healthcare innovations should be introduced or adopted in Germany, in your opinion?
Yep, I think a very easy answer with complex things that come with it. It basically means that if you want to be successful and introduce successful innovation in the German healthcare market, but also healthcare markets beyond, it needs to go through the doctor. It at least needs to be approved by the doctor, recommended, or even prescribed by the doctor. Which sounds very easy, but as Courtney has mentioned, given the squeeze of doctors also, of our healthcare professional and the healthcare system in general, this is super difficult, right? Because you ask them to do something additional to their initial work. You ask them to put in extra effort. Even if it would have tremendous benefit for the patient, you still need to show that to them, convene it to them, and also show it that this benefit to the patient is worth their time compared to other things they could do, right? And that's not the only thing. In addition to showing it to the healthcare professional, you also most likely have to show to payers that it has advantage. So that just leads to the fact, which I think is known to most people here, hopefully, that bringing innovation in this market is so difficult, because it's not just you bring a product to the market that has benefit for one person, for the patient, but it needs to have at least 4 benefits for yourself, of course, but then also for the payer, for the treating physician, and for the patient. And to hit these 4 check marks is so difficult.
Perfect. Ariane, one of the other findings, which I didn't cover at the top here of the report, was that 7 out of 10 Germans believe at least one divisive health claim. And Edelman has summarized that as vaccines are used for population control. 10% in Germany believe that. Paracetamol during pregnancy causes autism, I think a big thing in the States. And 7 out of 10 Germans believe at least one of claims such as these. Do you think that's a consequence of declining trust, or more a cause of it? So kind of a chicken and egg situation here. What are your thoughts on that?
Yeah, I think it's kind of both. So it's a consequence, and it also is something that leads to declining trust. I think a big problem also is what we see is that very complex topics are reduced to very simple narratives. And I can give you an example because that just recently was something on my line of work that we had seen. An investigative media coverage on our cancer drug Keytruda, which is one of the most widely used immuno-oncology therapies in cancer treatment. And there was a really large discussion on pricing, on clinical benefits, on let's say, the values of innovation that was practically narrowed down to a very simple message that in the end was that suggested the treatment might be massively overpriced. And the thing is, people that are not close to the topic, they lose the broader context. How prices are negotiated, because they are negotiated in a very, very strict environment, what survival benefits this medicine brings, and also how innovation in healthcare generally works. And that matters because, as we see, trust in health information is already fragile.
Yeah. So, as we've seen today in the data and also just in the talks the whole day, we've seen that AI is already influencing how people seek health information, interpret symptoms, etc. So I think we're all agreed in this room, AI is there to stay. It will shape healthcare. But the question for us at Edelman, or generally I think when talking to the general public, is how do we do that in a way that it strengthens trust? So Philipp, in your opinion, what do healthcare leaders still misunderstand about the role of AI and what it should play in healthcare?
Also a very good question. To answer, again, simple, I'd say a lot. I'd say if we all would have the same, understanding and opinion and vision of where all of this goes, most likely the room would be empty. We wouldn't have this discussion. So I'd say, given that it's still a new technology and that there's so much that can happen with it, there's so many different opinions on what should happen. Just recently I sat together with a couple of other pharma companies, and the main topic of discussion was how can we make our websites AI readable so that the models pick up on this, which I personally think is the wrong approach. The first question should be, how can it actually help patients, and how can it support them better? I think if you want to boil it down to one thing that I at least think will happen in the future more and more, is that what AI does is it democratizes knowledge and also ownership of your healthcare journey. Because as you mentioned in the beginning, even before the internet, let's say, it was, you went to the doctor diagnosed you and said, this is the treatment, and then most likely you believed it. Maybe you had somebody in your group of friends and families that had a similar issue, and then you talked to them about it. Then the internet came, you had more information. Now with AI, at least for simple diseases, you can get so much information about it before. And at the same time, also other players such as pharma is, at least in my opinion, moving from a pure drug manufacturer, if you want to simplify it very much, also to one of the partners in the healthcare journey, trying to support patients as best as possible. So I think we are witnessing a power shift, or information ownership shift, difficult word, where everybody is participating to different degrees in the healthcare journey.
Mm-hmm.
I think one of the things which very few people saw coming is the fact that we always thought AI is going to be smarter than us. It's got the combined brain power of 5 billion Earths or something, but apparently AI is also nicer than us, right? I mean, that's the empathy part, which we saw from the trust data there. So Ariane, we've seen in the next 10 years that data is always 40% of the current doctors are going to go in retirement. We've got doctor shortages, we've got less time with doctors. That issue of the second opinion, which may be a first opinion, where do you think, and that thing of guidance for a patient, we've got an informed patient or misinformed with AI answers coming to the doctor. What do you think is the role of AI going forward there in terms of second opinion, doctor face-to-face time and that interaction?
Well, I don't think that we should consider AI as a decision maker, but more as a second opinion that helps people navigate complexity. And this is what we are already seeing, right? I mean, for a clinician, AI helps make a tremendous amount of information accessible and maneuverable. And I think for patient, it often fills a gap. It's not that people are going to AI because they want to replace their doctors. But as you said, often access is difficult, so maybe it gives them a first opportunity to understand their situation better and also maybe to interpret things when they don't have the access. But I think there's also clearly the boundary that AI has. It cannot replace the medical judgment or the patient-doctor connection. And at MSD, we see AI as a powerful enabler from drug discovery to patient engagement. But still, it won't give us all the solutions. It will give us time to focus on things that we humans are best at, and part of that is building trust and genuine relationships.
Got it. Courtney, zooming out from the German healthcare practice around the corner to a more global perspective, what, in your opinion, your experience, distinguishes organizations that successfully build trust in AI from those that slap AI on the sign outside and simply promote it?
I mean, I think what we've been talking about is the power and the need for really strong communications. And I think organizations that are really taking the steps to explain, how are you using AI? How is it benefiting patients? How is it benefiting communities? How are doctors using it in partnership with others? It's really these real world examples, because the public is saying to us, I'm interested, I want to know more, but you have to tell me more so that I actually have trust. Research that we did separate from this report, but just a few months before, showed that right now, the concern and the fear factor is really real. You know, the number of people that actually say they trust AI in healthcare is well below 50%. And in fact, in certain places, when you talk about things like drug development, it's much higher. But that's because there's questions. People say to us, no one's really taken the time to explain this to me. So I think the first part is just really good communications. The second part, though, is listening to what consumers told us they think doctors do not as well as AI in their own care. And it's the points you raised, and globally it was even a little bit higher, but to understand the non-judgmental part, if 27% higher AI performs when it comes to not being judgmental compared to a doctor. That's the perception. I might come in and ask you a question, but you're going to judge me for it. And if AI is not going to do that, we need to build that kind of approach into the way that we're communicating with patients more regularly, thinking about the convenience and especially the empathetic component of meeting patients where they are. People said to us, if you can show me that you understand patients like me, that you've treated patients like me before, and here's how this approach benefited them, my trust in you is going to skyrocket. And I think all of our institutions can take those lessons away.
Perfect, because that brings me to that, I guess, more silver lining at the end of the report, which was we shouldn't be megaphone shouting out content information, but acting more as guides. So Philipp, as I said, it's less authority, more guiding. Your daily work has a lot to do with everything beyond the pill, I'd say. So what does that mean in practice for your organization? Like more of a guide, less only top-down authority?
Yeah. So first of all, I think the authority, you first have to see what was authoritarian before. And at least from a pharma perspective, I think, the touch points you had with the patients were relatively limited, depending which geography you're in, of course, also. So I wouldn't say that, at least for a pharma, it's shifting from authority to guide, but it's shifting from little interaction to guide. And I think that also relates to what I mentioned before on the democratization. And it's not only large companies such as MSD or Merck, but it's also small influencers that are at least seeing themselves as guides and sometimes do a better job, sometimes a bit worse job in that. And so I do agree. I think in general in the healthcare, throughout the healthcare journey, there are more and more players emerging as guides that previously didn't have a spot on the stage. I do think, though, that there still needs to be a bit of authority, and that definitely needs to come from your healthcare expert. Because as you mentioned before, that's the one entity that really is trusted most in the whole journey. And that needs to be the entity that also steers you throughout that flood of information that comes to you.
Got it. Before I head into our final question round, I think, Ariane, I've got one for you. Being in Germany, not always the most optimistic group of people. This is the summer we've got here, so this is all hitting on our mood. But like, what gives you the most optimism about healthcare in the next 5 years?
I think there's a lot to be optimistic about. I think science is greater than ever before. At MSD, for example, we are expecting to bring more than 20 new medicines and therapies to patients in the next 5 years, many of them with blockbuster potential. And that's not a projection, that is our pipeline today. Then if we look at the progress that we have already achieved, it's extraordinary. 40 years ago, 2/3 of cancer patients died. Today, half of them have the chance of being cured. AIDS was a death sentence in the 1980s. Today, people with HIV live a normal life expectancy. And we are pushing that frontiers. Just this week, published positive results from a phase 3 study together with Gilead, which could be the first once-weekly HIV treatment. So if you imagine one pill taken once a week, that has the same effects like now daily treatments, and that is obviously a great better for the life and for the quality of life of patients. And then this whole layer of AI and this innovation we see there, that we also have the chance to get these scientific breakthroughs faster to patients. So this combination really of scientific breakthroughs and then the ability to scale them much faster to bring them to patients, that makes me very optimistic.
That's good to hear. Then finally, and this is where we'll pin this to the wall and regroup in about 4 years. Courtney, I'll start with you. In 2030, who will people trust when making a health decision? Is it a doctor, AI, a community, or something, an entity we haven't even imagined yet?
Not to hedge bets and not give a straight answer, but I think it's a combination of all of those, and maybe it kind of falls into that last category of sort of like the entity we haven't imagined. But I think our data says it will be a combination. The physician, that healthcare professional voice will always be such an important part, but AI will also be part of that. But what we've learned is that we need to be thinking more broadly, because when we think about where the patients are in all aspects of their journey and the questions they have, they are talking to so many different parties. They are talking to community leaders. They're talking to people online that they trust, whether they have medical credentials or not. They are talking to peers and family and friends. And so our ecosystem has to incorporate all of these voices. And if we are putting out information on a new treatment, a new innovation, a new diagnostic that we want them to understand, we cannot just go to the physician audiences. We have to think about reaching it in all places. So when they're then asking, hey, cousin, what do you think about this new technology I heard about? Or they talk to someone else they know in their community online about something, the right information is out there, and especially so that when they go to Dr. ChatGPT, they are getting that right information back. We need to be reinforcing and really recognizing that it's not that there's too little information. Right now, there's too much information, and our job is not to give them more information. It's to help them cut through and really understand what resonates to them, to their family, and to their specific needs.
Philipp, same question to you from a pharma perspective.
I have to say I fully agree with you, Courtney, with two small exceptions.
Yeah.
So first is, I think it really also depends on the specific disease or the condition of the patient. Because I think if you think of 2030, there's definitely going to be, and we already see that now, right? There's going to be, let's call it everyday diseases, or not life-threatening, not rare. Where really the contact with your healthcare professional can be minimized to a certain degree, to also free up their time, of course, because it is not immediately life-threatening, for example. And then the second is I also think the healthcare journey is going to extend a lot more, right? When is the point that you start going to your doctor? It's when you actually notice symptoms. And with, pretty much everybody I've saw today, or many people I saw today, wearing some kind of smart device, I think the healthcare journey is going to extend a lot more. Of course, also in preventative care. I don't think that's news to anybody. But that's still also part of the healthcare journey. And I think there, a lot of trust is going to be put onto the big tech companies to tell you how to manage your life, how to manage your lifestyle, and how to prevent symptoms even before you have any encounter with your healthcare professional.
Got it. And Ariane, to close things off, you have the choice. Do you want to also give a prediction for 2030, or is there something you want to mention we haven't talked about today?
Well, I think we've touched very broadly on topics, and so I can just agree with both of them, that I see, that it will be a combination. It will be very exciting to see how 2030 turns out, and it's almost tomorrow. But I think we will see a lot of evolution still.
Perfect, thank you. And we've got a red number there, so we're at time. Like I said at the beginning, we could spend 90 minutes on the wonderful Edelman Health and Trust report. Don't hesitate to talk to anybody on the panel in the afterwards. And a big thank you to the panel.
Thank you.